This is Pet Life Radio. Let's talk pets.
Is your pet stressed out? Does your pet need annual vaccines? Which pet is best for a child? Would you know if your dog was in pain? Pet Life Radio presents The Pet Doctor, where you'll learn everything about keeping your pet healthy and happy. From pet care, pet meds and grooming, to pet food, pet insurance, and dental care, this is the place to find out everything there is to know about pet wellness. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets, because it's your pet. Health matters. Please welcome your Pet Doctor host, veterinary media consultant and veterinarian, Dr. Bernadine Cruz.
It wakes you up in the middle of the night. That noise. Where is it coming from? Did you really even hear it? You strain to listen, not wanting to get out of bed. There it is. Is it a cough, a gag, your cat hacking up a hairball? In the morning, the feline sleep wrecker seems to be just fine, eating and purring like normal. But there it is again. The cat looks like it's trying to clear its throat. Should you worry? Is it worth a trip to the vet? Cats can be a mystery, and like your car, you may get it to the veterinary clinic only to find that it doesn't make the noise. My guest, Dr. Lynelle Johnson, is currently professor in the Department of Medicine and Epidemiology at the UC Davis School of Veterinary Medicine and a clinician in the Internal Medicine Service at the UC Davis Veterinary Medical Teaching Hospital. Dr. Johnson's research interests include clinical respiratory disease of dogs and cats and interactions of the heart-respiratory system. She is an expert in feline asthma. We're going to be right back after the short break, so please stick around. We have lots to listen to.
Looking for a dental treat that does more for your dog? Daily Dose is a 2-in-1 chew that pairs a daily dental scrub with powerful supplements to help with the biggest health concerns facing our dogs. Daily Dose was developed by vets to be simple to use and super effective. Plus, dogs love the taste. Available for joint, skin, heart health, or calming. Daily Dose. Your pet's daily dose of awesome. Visit yourpetsdailydose.com to save $3 on your first bag with promo code PETLIFE. That's yourpetsdailydose.com.
Let's Talk Pets on PetLifeRadio.com.
Dr. Johnson, thank you so much for being with us. This is a case that I just saw yesterday, a cat that came in with these strange little respiratory sounds. And, I always have to wonder, is this a hairball? Is this asthma? So thank you for talking about it today.
Well, what you describe is really quite typical. And as you know, cats are so good at hiding their disease process from us. And so many times owners are frustrated because when they bring the cat to the hospital, they don't have any abnormal sounds. And that's one of the benefits of the proliferation of smartphones, I think, is that owners are getting very clued into the need to videotape or audio tape their pets. And so when they bring in a video, we can watch what the animal is doing. And it's really helpful because it highlights for me the severity of the disease process. Just as you said, owners hear a little bit of noise. They don't hear it very often. But if I see even one episode on a phone where a cat is hunched over, head and neck extended, and obviously creating a lot of effort to expire and to cough out material, that tells me we need to investigate this. So I rely a lot on the owner's description of the events. It's very rarely a hairball. I would say that if a cat is expelling hairballs, owners will see the material, and they'll oftentimes see in a litter tray that the animal has hair in its stool. So most situations, it is a cough and it is asthma or bronchitis. Those are the most common causes of cough in the cat.
Dr. Johnson, so what exactly is feline asthma? People have heard of, my cousin has asthma, or I had asthma as a kid. What is asthma?
That is such a great question. And I can tell you that the more I read, the less I know. And
Thank you. You make me feel better.
we're all used to that description of asthma, and I've been diagnosed with asthma. And it causes me to have shortness of breath and my chest feels tight. How do you know if a cat is short of breath or has tightness in its chest? That I think is the key question. What we tend to say is that if a cat has an episode of respiratory distress with expiratory effort and wheezing that can be reversed by administration of a bronchodilator, that would be the classic definition of an asthmatic. Now, what we do in the clinic is we say, well, a coughing cat could be asthmatic. It's inflammation in the absence of a discernible cause that leads to a cough. Is that asthma? Is it bronchitis? Is it caused by allergy? Humans get so many respiratory allergies that we tend to say that it's an allergic etiology, and maybe in some cats it is, maybe in other cats it isn't. So it's really challenging to say what causes it. And because of that, it tends to be a disease process that we manage rather than cure. And we can talk a lot about various tests we can do for this condition, but I think that every cat has to be approached as an individual.
So it sounds, though, if I'm listening to you correctly, it's more of a complex of diseases, and sometimes you can't honestly say, is this allergy? Is this bronchitis? You're going more by the clinical signs of what you're seeing. And many times, the only time we see those clinical signs is when the owner takes that video on their camera.
Yes, that's the way I think of inflammatory airway disease in the cat, whether it's asthma or bronchitis. Sometimes cats develop wheeze, which we would say is asthma. More often they cough, and people would say that's bronchitis. Other people say if you do an airway wash and it's eosinophilic, if you see those typical cells that we expect in an allergic response, then that would be an asthmatic. Whereas if you see neutrophils, then that would be bronchitis.
So eosinophils and neutrophils are white blood cells. So eosinophils go along with like allergies and parasites. And neutrophils, you think of infection.
Yes, exactly. But importantly, neutrophils can also just be a sign of chronicity. And in some diseases, eosinophils occur acutely, and then neutrophils predominate. So just as anybody who treats a lot of cats will agree with, cats are always trying to confuse us. They never help us with their diagnoses.
Well, speaking of diagnoses, oftentimes you think of asthma, children having asthma seems to be when it oftentimes is diagnosed. So for cats, is it a particular breed of cat? Is it an age of cat? Is it gender? What are kind of, you think, oh yeah, I see this and I'm thinking more of asthma. What do you look for?
Well, I think all ages of cats can get asthma or bronchitis. In general, when we see cats that have more of these eosinophils in the airways, they do tend to be younger, whereas the older cats tend to be bronchitic. So it may be a disease that we should anticipate in the 2 to 5 year old cat, but I can tell you that cough in the cat spans every age, every breed, every gender. Some people used to think that Siamese cats had a more chronic nature of disease, maybe a more severe disease, but I think that's really hard to say. To me, the main thing I worry about is saying, is it asthma or is it something else? Because if it's something else...
Perfect lead-in. I was going to say, what are some of the other things that this can be?
We have looked at a lot of bronchoscopy data in cats, and we've also looked at a lot of cats that just present with cough or respiratory difficulty. And I think one of the things that can be mistaken for cough as a cause of cough is a pneumonia. And believe it or not, long-term cough can be related to infections in cats. If a cat goes outdoors or if cats are in certain environments, we think about parasitic lung disease, and certainly in really young kittens, 5 to 8 months of age, I've seen some severe respiratory conditions associated with parasitic pneumonias. In some areas of the country where heartworm is prevalent, that has been recognized as a cause for coughing as well as vomiting, respiratory distress. So there's a number of different disease processes we worry about.
I know one cat in particular, and this was a cat that I had diagnosed with having asthma, looked at radiographs, and we can talk about how you can diagnose it, and it was responding well to medication. And then it just became uncontrolled. And we tried changing this, changing that, said, I think it's time we need to take an x-ray again, see what's going on internally. And this poor little baby had cancer in its lungs, and it just seemed to come up overnight. And I'm sure it had been building up, and we were thinking, this was just the asthma, flare-ups every once in a while, and nope, it was something more serious. So things can change.
You're exactly right. And one of the things we've learned recently, although steroids are highly effective in controlling signs of asthma in the cat, they can actually lead to heart disease and significant heart failure. And so you're exactly right. We do need to look for reasons why an animal might not be responding appropriately to therapy.
So Dr. Johnson, we have a cat that's making noises at home. Owners have taken their video, shown it to you, shown it to their daytime veterinarian, and said, yeah, kind of looks like it could be asthma. What are the next steps? You talked about bronchoscopy, and I talked about x-rays. What are the steps that typically are taken to help rule in or out feline asthma?
Well, of course, a lot of it depends on the owner's wishes and the owner's desires and the owner's pocketbook. And even though I work in a university setting, I deal with students' cats, my colleagues' cats, and animals that are perhaps not good anesthetic candidates. And not every cat needs to have a bronchoscopy done.
What is a bronchoscopy?
Oh, bronchoscopy is the most amazing tool that we have in respiratory medicine. We take a small camera, less than 3 millimeters, on a long cable down into the lungs. We look around the lungs for evidence of mucus, nodules that would indicate chronicity, and we can inject and aspirate a small volume of fluid to look at the cells and also to look for infection, parasites, and even cancers. Now, that is a very specialized tool, but regular veterinarians everywhere can do a tracheal wash where an endotracheal tube is placed in the cat. We pass a catheter, inject and aspirate a small amount of fluid. It takes only about 10 minutes. So for me, collecting an airway sample is a critical part of the diagnosis. But it's usually after a certain time has gone by and I've talked to the owners about what their goals and desires are. You can imagine if you have a 2-year-old cat that's coughing, and asthma is the most likely diagnosis. You talk to the owner about what needs to be done. I want to rule out infection and look for evidence of inflammation. And first we'll start off with radiographs. And you have probably experienced this in your practice. You do a radiograph and it looks relatively normal.
It's very frustrating, yes, because I have to come back and go, well, I can tell you what it doesn't have. That's good.
That's exactly right. It's probably not pneumonia. It's not heart failure. It doesn't appear to be cancer. But I can tell you that a lot of cats with very significant airway inflammation have normal chest x-rays.
Thank you.
And that's why in my practice, I like to do an airway wash. Now, what if an owner doesn't want to anesthetize or can't afford to do an airway wash? Well, you could think, could this animal have an airway parasite? Should we do a trial treatment with a drug that treats parasites? Could it have an infection? Should I give the cat a course of doxycycline in case it's mycoplasma? And I know a lot of people say, well, the most likely diagnosis is asthma, just give it steroids. And I was a regular vet for several years before I went back to get additional training. And I know that that's what is sometimes used to make a diagnosis. And if that's what your practice philosophy is, if that's what owners can afford, and you want to help the cat, then that's what can be done. One thing I would warn you of is that cats can respond to steroids even when they don't have asthma or bronchitis. And once we say that a cat has asthma or bronchitis, I think we're saying there's a high chance that cat needs lifelong medication. And if you have a 2-year-old cat and I tell you, okay, you're going to give these pills for the rest of the cat's life, that can be a bit of a challenge too.
Especially cats. Well, I'm chatting right now with Dr. Lynelle Johnson. She's from UC Davis School of Veterinary Medicine and the teaching hospital, with her specialty being respiratory medicine. We're going to take a short break, be right back, talk about what some of the causes are of asthma, one of the things that can exacerbate it, make things worse, and how we go and treat this cat that may be on lifelong treatment. We'll be right back after the short break.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
For those fortunate to have experienced the deep bond and unconditional love of a companion animal, the death that follows can be one of the most difficult and misunderstood losses to go through. Many times, this devastating loss goes unrecognized and trivialized by family and friends, leaving grieving pet parents struggling to find healthy ways to cope with the loss. In And I Love You Still, a thoughtful guide and remembrance journal for healing the loss of a pet, Dr. Julianne Corbin calls attention to the difficulties unique to the loss of a beloved pet and provides an interactive and compassionate guide to help you process your loss and work towards coming to a place of peace and healing. For those interested in journal therapy and looking for a professionally written and compassionate resource to help understand and reconcile the grief associated with the loss of your pet, this book is for you. And I Love You Still, a thoughtful guide and remembrance journal by Julianne Corbin, is now available for purchase on Amazon and other major book retailers.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to the Pet Doctor on Pet Life Radio. The doctor is in, and we'll see you now.
Dr. Johnson, right before the break, you were saying that, here's this cat, 2 years of age, young baby that we've diagnosed as having respiratory disease. Looks like it, smells like it, tastes like it. It's probably asthma. Steroids work, that's one thing. But as you were saying, steroids can have adverse side effects, especially if used long term. What are some of the other treatments that are out there that are available to use? You think of asthma in a person and you use inhalers. Well, I know that you can use inhalers, but I'll let you talk about that.
Yes, I think that it's fantastic that so many people are now using spacing chambers and metered dose inhalers to manage asthma, because it has really improved our ability to control the disease long term with better compliance and with better outcome. Of course, the main problem is the cost of the medication. A 2-month supply of Flovent, which is the steroid inhaler that we recommend initially, costs probably $250 to $300. The spacing chamber that I like to use is made by Trudell Medical Corporation in Canada. It's Aerocat, A-E-R-O-K-A-T. They have a nice website with some videos that show how the drug can be administered, and it's a relatively cost-effective $70 or something for that spacing chamber. Most cats can be trained to accept a face mask, but if we don't train owners, if we don't train the cat to accept the mask, to breathe in 6 to 8 breaths, then it's not going to be effective. And one of the things that I found in some cats is that they have such thick mucus in the airways that the drug can't penetrate the site of action. And so simply starting a cat on an inhaled medication will not resolve clinical signs. So some cats need to be on oral steroids at the same time as that they're on inhaled medications. Other cats need to have their secretions liquefied with nebulization. And that's been a really beneficial technique that I've used in cats that don't respond well to inhaled steroids.
I'm glad that you brought up the nebulization because I had a particular cat I was having a horrid time trying to control. I said, okay, I really need to have this kitty seen by a specialist, someone with more initials after their name than I. So we're very fortunate in my area to have several groups of board-certified veterinary internists. So trundled the kitty up there with the owner and came back, and something's like, I had never heard of this. And it was a very small little portable nebulizer. They got it on Amazon. It was about $40, $50. Then they had various components, liquids that they had compounded at one of our local pharmacies. And some was a steroid, some was a sodium chloride, basically a sterile water, and other components, and put it in this. Kitty would sit in this little carrier, kind of cover it up. The nebulizer was put in front of it, got a steam treatment for about 10 minutes, and poof, it was done. And for that cat, it worked very well. Is that what you're somewhat talking about, nebulization?
Yes, and it can be even easier than that because you don't need to compound and administer a medication for this to be helpful.
Awesome.
So choosing the nebulizer is critical. Absolutely, they are available on Amazon. I recommend people do a little bit of research to find a nebulizer that creates 2 to 5 micron particles.
That's teeny weeny weeny.
Teeny weeny weeny, because those go all the way down to the lower airways. And there's a wonderful website, justnebulizers.com, where I visit and I look at the various products. There's some that are very quiet, some that are very small, some have an attachment for the car, so you can nebulize the cat as you travel. But creating those small particles is critical, and I recommend to my owners that they get sterile saline vials. One company that makes them is Addipak, Addipak, and they're single-use vials. You pop it open, put it in the nebulizer, and just hydrate the cat's airways. And I have found this technique to be so beneficial in dogs and in cats with lower airway disease. I actually have an hour session with my students where I discuss all of this adjunct respiratory therapy because I think it's very beneficial. If the mucus becomes more liquid and the cat can cough that out more readily, then the drug can also contact the receptors in the lining of the airways, and the drug can be more effective. So I'm a big fan of nebulization.
It's somewhat like when you're having a really bad chest congestion, you take a steamy shower, those particles are way much, bigger than the 2 to 5 microns, but still it feels better that you're getting that moisture down in your lungs. It's like, oh yeah, you can really cough up that loogie, and it's like, thanks, I feel so much better.
Yes, and I've had many owners say that their cat likes their spa treatment.
So besides nebulization, I know one of the things clients oftentimes call me because I do stem cell therapy, and VetStem is the company I typically recommend, and they're wanting to know, can we use it for things like asthma? And I honestly don't know, so I will ask you.
Well, there was a study that looked at use of stem cells in the experimental model of feline asthma, and it didn't really demonstrate a tremendous benefit. That's been a number of years ago, and I don't know if those groups are doing further research on that. But there's a lot of things that are done in human medicine that people have tried in cats. I mean, if a person had very severe asthma, they might use immunotherapy. But that relies on knowing that it's allergic, and we don't really have good tests for allergy in cats. We can do the serum tests, we can do the skin tests, but do we know that what an animal reacts to in the skin or in the blood is what's causing it in the lung? And I think, as I told to you before we started, I sometimes feel like the more I read, the less I know, because there's just so much that we need to understand about animals and their disease processes.
But please keep reading, Dr. Johnson, because you help people like me. I know that UC Davis is being surrounded right now by horrible fires in Northern California, and smoke is affecting a lot of people, having a hard time breathing. And I can imagine that there's a lot of cats and dogs right now through California, throughout the Western United States and elsewhere, who are having respiratory issues, exacerbations of their respiratory issues. What else can make the signs of feline asthma worse?
Boy, you are so right about the effect of the terrible fires on animals with respiratory disease. And it's not just the immediate effects of the smoke in the environment. The particulate matter and the constant inhalation will lead to problems for years to come. And we know, especially in developing respiratory tracts, that this is a significant problem. I think that smoke in the environment from cigarettes, dusty litters can cause exacerbations, and perfumes in the environment, cleaners, something as innocuous as using a carpet spray or a carpet powder as a freshener can be damaging to a cat. If you think about, cats are down by the carpet all the time, so anything they inhale could worsen their syndromes. None of these things cause asthma, but all of these minor events for us could cause pretty substantial problems for cats. So I think having owners just be aware of the environment that their cat lives in, making sure they keep the house clean, empty the vacuum bag, and take care when we change out seasons. Think about the furnace going on and spraying molds into the environment. Think about your air conditioner and how that's going to change the air quality for the cat. So there's a lot of things that we might not appreciate, but the cat can definitely inspire and have greater difficulty.
So, Dr. Johnson, you mentioned cat litter, and that's one of the things I'll typically ask. Do you use an open box or a closed box? And I really, really prefer, for basically all situations for a cat anyway, to have an open box, using as dust-free litter as possible. And many times just taking off that box, like, oh, thank you, instead of sitting there inside of this dusty chamber, because the tops are really put on, I think, more for you and I, so you don't have to see it and smell it. And here's this poor little baby whose nose is down in this litter, breathing this stuff all the time.
You are so exactly right. And one of the cases that I like to tell other veterinarians about was a cat that had been treated for asthma for over a year, came up to see us, and when we did an airway wash, we found that litter particulate matter in the fluid.
Oh, terrible.
Yes, and it was everywhere. So that cat had foreign body inhalation from the litter. So we took the top off, we switched to a dust-free, sometimes that pelleted newspaper is nice, and the cat's clinical signs resolved. So it is so right that indoor air quality can be have a huge effect on the cat.
Well, one of the other things too, you're mentioning about the perfumes in people, because yes, I have a girlfriend that whenever I go out with her, and the old pre-COVID days when I could go out with friends, that I could not wear perfume. That really set her off. So yes, besides having those open litter boxes, to have the unscented litters, because again, that scent is made for people, really not for cats. Cats don't care that it smells like lavender. It's like, nope, I just want to go potty, thank you very much, cover it up, and get out of here.
You are so right. Those are things that we as veterinarians can be really helpful on to allay some of the issues that owners might have with litters is very important. And things like fireplaces are really nice for us when it's cold outside, but not always the best thing for a cat.
And you said smoking. I've had a lot of people who will not give up smoking until all of a sudden they say, your cat has asthma, your smoking, even if you smoke outside, is not good for your cat. And they go, fine, I'll give it up. So,
well,
works?
Good for you. I've only had one client in 30 years who gave up smoking for their animals. So that's great.
Is asthma curable?
Well, you mentioned stem cells earlier, and we talked about immunotherapy. Those are the types of treatments that are used in humans to essentially cure asthma. I don't think we're there in cats, and one of the problems that I see is that owners think the drugs are working, and so they stop them. And the cats are fine for a while, and then the clinical signs return. And cats are so good at hiding their disease processes that I tell my owners, asthma is a lifelong condition. Could your cat grow out of it? If it's 2 at the time that you diagnose it, could it be absent of clinical signs by 8? Well, maybe, but let's not count on it. And as you said, the clinical signs in that cat returned, you repeated x-rays, and it was cancer, not asthma. So we always have to be aware of how the cats will hide disease processes from us.
And can asthma kill a cat?
Yes, it certainly can, in a number of ways. The actual disease process can lead to an asthma attack, where the cat can't breathe and it dies. I also recently had an owner who could not afford to do inhaled medications, could not medicate the cat, and was relying on injections to control clinical signs. And the cat developed diabetes, and at age 4 had to be euthanized. And I've had some cats with very severe disease that are in the emergency room so frequently that owners have elected euthanasia because of that. And that's why I look at it as a disease that we must manage and be fairly aggressive about.
So as we have to wrap up right now, what are your words of wisdom for somebody who wakes up in the middle of the night and hears their cat making some strange noise? And is it, isn't it, what do I need to do?
Get out the camera, put a webcam on your cat, but most importantly, contact your veterinarian and talk to them about these signs. And understand that blood tests can be normal, chest x-rays can be normal, but your cat can still have a significant respiratory disease. So rely on your veterinarian's expertise. Work with them to come up with a solution.
Don't ignore it.
Yes.
I've had the pleasure of speaking with Dr. Lynelle Johnson. She is currently a professor in Department of Medicine and Epidemiology at UC Davis School of Veterinary Medicine. And as you've heard, she is an expert in respiratory disease, especially asthma. Dr. Johnson, thank you for being with us today. Really do appreciate it. Great information.
Thank you very much.
This is Dr. Bernadine Cruz. You've been listening to The Pet Doctor on Pet Life Radio. Thank you so much for listening. Please tune in again next week. We'll give you more information on how to make you that best possible pet owner. Take care.
Pets can be a wonderful addition to your life because they're a member of the family. Keeping them healthy and happy is important. Pet Life Radio presents The Pet Doctor with veterinary media consultant and veterinarian Dr. Bernadine Cruz. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets. The Pet Doctor, on demand every week, only on PetLifeRadio.com.